Now, over 1,000 dead, another 1,800 probable or infected. The World Health Organization has declared the Ebola outbreak ravaging West Africa an international health emergency. Guinea, Sierra Leone, Liberia and now Nigeria all battling the scourge. China has responded by sending medical teams, equipment and food aid to the affected countries.
Touchdown in Liberia. Before landing here, this Chinese cargo plane of aid had already stopped in Guinea and Sierra Leone. Its objective, to deliver around $1.7 million worth of emergency equipment to each of the countries worst affected by this Ebola outbreak. Inside, 30 tons of protective equipment like suits, gloves and masks, as well as infrared thermometers. Chinese officials say it's their duty to help.
China and Africa is always a common community, we think, and we hold each other, yes, and help each other. And, we still remember in those deadly earthquakes happened in 2008 and in 2010 in China, the African countries quickly responded and rendered help to China. So at this time, for Chinese government, yes, it's our duty to do this. Yes.
5 months in, and this Ebola outbreak has killed nearly 1,000 people across 4 countries in West Africa. It's the world's worst ever Ebola outbreak. Affected governments say their healthcare systems are stretched to the limit.
We're very appreciative of this supply. As you know, this is a situation that is unknown to us, and all of the help we can get from our friends is very much appreciated, very, very much appreciated. This consignment, as we see, contains some protective, gear, and we hope that that will help reinforce the efforts that we're making for containment.
The Liberian government has accepted that it can't deal with this Ebola outbreak by itself, so it's relying on international partners like China to provide donations like this one. Following this supply of aid will be a medical team of 3 disease specialists.
From here, this aid will be sent by Liberia's National Ebola Task Force to the areas that need it most. The medical experts, when they arrive, will help coordinate its deployment, as well as provide their expertise to local healthcare partners. Caterina Vitozzi, CCTV, Monrovia.
Well, the World Health Organization has warned that the Ebola outbreak in West Africa constitutes an extraordinary event and a public health risk to other states, which requires a coordinated international response to stop it and reverse the spread. But exactly what lapses and failures allowed a localized outbreak in Guinea to degenerate into an epidemic that is now threatening entire countries? Joining us from Beijing is Dr. Liu Xiaoyun, an associate professor in health systems research. From Washington, D.C. is Mr. Ni Akuete, a policy analyst and member Trans-Africa Forum Scholars Council. And in studio here with me is Dr. Lubano Kizito. He's a health systems policy and research analyst at the health sector and a doctor at the Kenya Medical Research Institute. Gentlemen, welcome to the program. Let me go off to Beijing. Dr. Liu, there, you're watching the public health development in Sierra Leone, Liberia and Guinea, and now in Nigeria. And you're watching the international response, China's response there. What is your take on the epidemic itself, first of all, and on the response so far?
This is the first time that China has sent a medical team of public health specialists to a foreign nation. Because in the past past decades, China has sent. We received many international aid programs from many bilateral and multilateral organizations and countries, and as China has economics keep on growing, and our capacity in health system development is also increasing. We are now more in a transition period of receiving less and less aid program, but providing more, play a more and more important role in providing assistance to other countries.
Well, China is now sending medical teams, and it has sent equipment there to the West African countries. Is this a signal, though, that China, moving forward in the future, will be more engaged in public enterprise in Africa?
Yeah, I think, yes, from a researcher's observation, China will be more and more engagement in the international assistance, not only in this kind of public health emerging, but also in other areas like developing human resources and introducing new maternal child health programs. Yes.
Well, China does have experience there, though, with other epidemics like the SARS and the bird flu. Can African countries, though, borrow a leaf from China's past experiences?
Yes, definitely. But China, we have a rich experience in public health program in dealing with the infectious disease. We have done quite well in the traditional infectious disease like TB, malaria, and HIV/AIDS. We also gained the experience in the new emerging infectious disease, like in 2003, the outbreak of SARS has taught us how important a public health program is and how to mobilize the community and the whole society to deal with this threat. And in China, we have built a strong public health system from the national level to the province level and to local level. And we believe that this important experience must be very valuable for West Africa, who are now facing the Ebola virus disease epidemic.
Well, this is the first time, though, that China is offering assistance of this nature and to a disease such as this to African countries. Why is China attaching importance to this one?
China, indeed, since 1963, over the last half century, China has sent medical teams to provide medical services to the local people in African countries. We have sent about over 20,000 medical workers, mainly nurses and doctor nurses, to provide medical service to millions and millions of patients there. So this turns out to be a very successful program. Although this is the first time we sent a public health specialist, but on the medical team, this experience has been for half a century. I think there's two reasons there. One is many African countries are in great need of support in health sector. The infectious diseases are still highly prevalent there, and many countries are in need of increased number of doctors and nurses. They are in shortage of medical equipment and supplies. So this is one reason, because the African countries are in need of service. And the second reason, I feel, is China and many African countries we have a long tradition and good relationship. It's a friendly relationship. So I think in summary, for these two reasons, it's a friend in need, now which makes a friend indeed.
All right, Dr. Liu Xiaoyun, an associate professor in health systems research, joining us there from Beijing. I do thank you for your insights. Now, Dr. Kizito, let me come to you and revert back to the scourge itself now. The statistics remain quite scary, and Dr. Liu has just talked about Africa needing resources. I think the question here should be, how did we get to this level?
Thank you for this. I think there are 4 points, and right from the beginning, in terms of the failures and the challenges. Number one is control of infectious diseases relies on detection of clinical cases, then isolation and treatment, and then cure of those cases. And these strategies are all usually reactive, because you cannot control something which hasn't happened. And by their very nature now, that means the number of cases which will have taken place without showing signs, that is where it will determine the spread of the disease.
This happened in Guinea about 6 months ago, and it wasn't highlighted then. I mean, 6 months later, that is when the international response is coming in. That is when we're now talking about 1,013 people dead. How did we get here?
Thank you for that. I think there are multiplicity of factors, and what's going on in that is that the epidemic of Ebola by itself has changed in the way it presents. The first initial presentation were episodes that were far apart, but now it seems to be more coming closer and to be worse. However, in terms of when we have known about it, I guess that is something that has to do with the way things are communicated. It's not every other day that people communicate from a village in Guinea to others about a problem. Until it reaches a certain level, then it will perhaps attract the media. So notwithstanding that, I think also the question of where it is taking place. In Africa, for example, now we face a triple challenge. The first challenge is we have a huge burden of, for example, other infectious diseases like malaria, TB, HIV, and so on. The second one, now we are also experiencing a lot of cancer and other non-communicable diseases. But the elephant in the house is the weak health systems that we have. So often than not, we are struggling with one thing or the other. And not to forget to mention the issues of maternal health and child deaths. So sometimes our systems are struggling to grapple with all these issues at the same time. So by the time the question of Ebola comes to the front in a struggling system, it's perhaps sometimes too late.
All right, Mr. Akwete, let me get your input into this. How are you reading all this? Because the other guests on this in this program are talking about lack of resources, health systems struggling. How did we get here? Where is the failure?
I think Dr. Kizito mentioned a word that grabbed my attention more than anything else, reactive. I think he's completely right that you might have suspicions, but you react only when certain emergencies break. And it seems to me, I mean, I am no doctor, nobody mistakes me for a doctor, but looking at public policy and economic development, it seems to me that African countries are reacting to things that happen. I mean, Dr. Liu in Beijing also mentioned, bird flu and SARS outbreaks, which we have seen a lot in China. So no country is immune from these health emergencies. It's a question of how well do you react? How quickly do you detect them? And I think that given Africa's low level of development compared to other areas of the world, it is no surprise that it took a while to react to this. And also that this is particularly virulent. If I'm not mistaken, Ebola was first discovered in about 1976, and all the experts are saying that this is one of the worst outbreaks. So it's taking even WHO by surprise. It's taking the African countries by surprise, and the African countries, given the poverty and the other burdens that they carry, they don't have the best healthcare systems.
All right, we don't have the best care systems here, Dr. Kizito. What happens now?
I think we, like everything else, we have to respond with what we have. And if we do the best with the little we have, usually we would be able to mitigate the impact. And I guess that is the direction we should be going. In terms of looking at the whole continent of Africa, I guess sometimes you have looked at round about the last 50 years when most African countries got their independence. We have not had much investment in real building up the health systems, in training sufficient numbers of people and putting the money there. And in terms of outbreak, for example, preparedness, we are supposed to have, as part of the health systems, an integrated disease surveillance system.
All right, Mr. Akwete, so looking at where we are at the moment and what Dr. Kizito is talking about, where does the buck stop?
Of course, the buck stops with African governments and other authorities. And, I am fond of saying I'm a democracy activist. I look at policy and I think that democracy is the best way for countries to be governed because, for instance, this program, I think part of a democratic system is a free media, is aggressive journalism that uncovers things that governments want to cover up. And I bring that in to say, so that is needed, but so the buck stops with African governments being held accountable democratically by their citizens. But world help is needed as well because it won't stay only in Africa if it is not contained.
All right. Yes, go ahead.
Thank you, Mr. Akwete. I want to weigh in just a little bit. And the question I sit here today and ask, today as we sit here, where is the African Union? Where are these economic blocs like ECOWAS for the West Africa, the East African Community, SADC, and so on? Our leaders should be speaking right now with one voice and showing solidarity with the countries which are heavily affected. For example, Liberia, where the health systems have literally fallen apart. But right now, the African Union needs to be very visible and very loud, and the other economic blocs, because traffic of people and trade and exchange of goods has to still take place anyway. But we really need to put it into perspective by providing the leadership and encouragement and the solidarity and support for our brothers who have been and sisters who are being affected.
You mentioned that the systems of Sierra Leone and Liberia have all but collapsed there, and we are hearing reports now that, you know, Liberia itself is saying they've lost about 32 health workers, and therefore they cannot really contain the disease. I mean, is there still much danger now with the international response of the disease spreading, or can we say it is fairly now contained within that West African region?
I think it might be too early to say it's contained, because again, just beyond the health workers and the health systems, remember, like in other countries now, they are deploying their security forces to quarantine people. The security forces being on the front line, definitely they are also going to be hard hit. And in situations where we have usually armed conflict and all manner of things, when you now start hitting the frontline people, the security forces, the health workers, and so on, right, you can see that the countries or the states are going to be in a very fragile state, notwithstanding the economic impact already of people not being able to move freely, or all other systems within that are supposed to attend, for example, to the maternal health and child health, now everything being diverted to go and attend to this.
All right. Mr. Akwete, your take on the measures that have been taken by the regional countries in trying to scamper the scourge?
I think Dr. Kizito is right that Africans need to help each other, the regional organizations. Now, again, not to defend them too much, because I think they need to do more, but I think they have done some. For instance, I know for a fact that the West African leaders met in Guinea, Conakry, and this is where they decided that many of them will stay away from the summit, and delegated President Condé from Guinea to come. And so they have been talking. I also happen to know that the African Union has been talking about it in Addis. Now, I think there is a role for the media, because these things are not well known, depending on how well the media publicizes or doesn't publicize them. But also, we need to understand that it is significant. I'm not saying it is causal, but it seems to me there is a correlation. The countries where this has erupted have been under conflict for a long time, and many of their health and other infrastructures have been devastated. Sierra Leone has lost 2 or 3 of its best doctors. So Dr. Kizito is right. The personnel in those countries are being hit hard, and now that they are deploying soldiers, we have to look at those also being hit hard. So these countries do need help, and they should get the help, and then we can sort things out later. I might throw in one more thing as a policy analyst looking at development issues. I do hold some of the policy prescriptions that for years we had before. Yes, briefly, you know, the international financial institutions, World Bank, IMF, they have always frowned on social investments like education and healthcare. And therefore, I think this is a wake-up call for them that investment in these social services are very important and can actually lead to better economic growth. So we have to look at the development paradigm also.
All right. Mr. Ni Akwete, policy analyst, joining us from Washington, D.C., and Dr. Lubano Kizito. Do stay with us, gentlemen. We'll return to the program in a moment. Welcome back to the program. So are there lessons from the West African crisis, and what long-term curative and preventive strategies can be jointly developed to counter future outbreaks? Still with us on the show from Washington, D.C. is Mr. Nii Akuete, a policy analyst. And in studio with me, Dr. Lubano Kizito, a researcher at the Kenya Medical Research Institute. Dr. Kizito, are there lessons here from the West African crisis? Because clearly the outbreak in the DRC was in 1976. There was another outbreak of Ebola in Uganda in 2000. And now this one. Is Africa learning any lessons here?
Thank you. Again, I think there are major lessons that have clearly demonstrated, and thanks to the media now, which is able to capture the stories and bring them to us, that we clearly seem to be far in terms of being able to respond in good time and to save lives. So that comes back to us in terms of investment and having early warning systems that can be able to respond to this type of emergencies. Because Africa, we are known for the poverty, sometimes for hunger. We want to change that narrative, and all manner of things of conflict, always floods and fire and so on. So yes, there are lessons learned there, and what I would suggest perhaps in terms of the long term, notwithstanding the first steps can be made now, is for all countries to have what I would call the national incident management systems, which have a number of people from different sectors, the civilian, the security forces and so on, that train together and simulate this type of emergencies when they take place. And when an emergency takes place, they actually respond to the emergency as opposed to coming together now to prepare on how to respond to the emergencies.
All right, Mr. Akuete, from a policy perspective there, from your policy view there, are there lessons, though, that Africa is learning from this incident?
I think there are. I think, you know, African countries have spent a lot of time chafing at policy prescriptions, especially from Washington, that says, don't worry so much about social investments. I think this strengthens their hand that, look, social investments actually are a good thing. And then the early warning systems that Dr. Kizito and I have both talked about, I think those are absolutely key. Just because you don't see an outbreak for a number of years doesn't mean that you should close your eyes. So I think African countries should learn the lesson that they need to ramp up the early warning systems. And of course, it has to be integrated against conflict, against environmental stress, against famine, but also against things like disease. So you basically, a lot of things that people have been talking about is we have to look at human security comprehensively, and that includes the health systems.
All right. Mr. Akuete, there was an ethical question that was raised before the World Health Organization gave the okay to use the drug, though. But there was an ethical question raised as to why the drug ZMapp was given to the 2 Americans and 1 Spanish, while thousands or 1,000 Africans were dying.
I think that is such a great question. And it raises, it makes people uncomfortable. In fact, the newspapers here feel a little defensive, so they've gone to looking very much at all the decisions made. I still think it doesn't really clear up the issue, because in fact, one of the people who was denied the experimental drug was the leading doctor in Sierra Leone, Dr. Khan, and he died. And it was Doctors Without Borders who simply decided that they were not going to give him the medicine. So that raises an issue. Now, on the other side, though, there have been long instances, and I'm sure Dr. Kizito knows this better than me, there are many incidents where people were treated with unsafe experimental drugs. So you've got those 2 extremes that you have to weigh. My problem with not giving Dr. Khan in Sierra Leone the ZMapp drug was that they did not even talk to his family, and yet they quickly gave it to 2 Americans and a Spaniard. So I think that is a very hot potato, and these authorities, especially all of them, were outside authorities coming in to help. They have to explain their decision, and they have to learn that they need to involve African authorities and African people they are working with and listen to them. If they had listened to Dr. Khan's family, they probably would have made a better decision.
All right, Dr. Kizito.
Yes. Quickly, I think there are two things here that need to be considered. There has been cases before of litigation when side effects and the drug didn't save the person. So I think it's kind of a catch-22 situation.
But you're being given a situation whether if you don't take the drug, you could die. If you take the drug, you might live.
Exactly. And I guess it's not an easy thing, especially being a clinician. I know to put your hand there, you know, there are so many other things that could go wrong. And this is a very key person, is a prominent doctor, and you are not too sure about things and so on and so forth. So maybe a little bit of benefit of doubt. But going forward, we know, for example, now that sometime back during an outbreak in 1995, there were 8 patients who were given the serum, that is the blood of those people who have survived. And out of those 8, 7 of them survived. So my take now is very simple from a research point of view and from what we Africans already have and can use. These about 2,000 patients who have been infected, 1,000 have died. We have the 1,000 who have survived. We can be able to harvest that serum because people have been talking about secret serum. There's no secret there. We have these 1,000 people sitting somewhere who have survived this, and they have something in their body. If we can be able to harness it, harvest it, and be able to use it, it will not need us to start complaining about other people's systems.
If this is known, though, by the medical profession, why isn't it being done?
Thank you for that question. And this is my next point that I was going to talk about. Right now, we need to invest into our own homegrown systems in terms of research and producing pharmaceuticals. There is what we call neglected drugs initiative that looks at conditions like, for example, Ebola. Some of the drugs have been in the works for some time, but because it's not a fashionable disease, quote, quote, they have never been taken to the next stage. So it's up to us Africans now, our governments, to invest in research, especially, for example, Ebola or other conditions that might not affect the other countries who might not see the need to invest in, so that we can put our money there. We have the brains to be able to come up with our own products which we can use in our populations.
All right. Mr. Akwete, we're going to wind up in a moment here. If you were to leave us with one word, what would that be?
I think with what Dr. Kizito said, the African governments need to become firmer in their convictions and insist in providing the kind of medications and development and healthcare, even when international opinion and bodies are telling them that they cannot afford it. These are investments. They yield good results maybe down the line, and African governments need to be much firmer in dealing with the rest of the world.
All right, Dr. Lubano Kizito, a health systems policy and research analyst at the health sector, and a doctor at the Kenya Medical Research Institute. Thank you very much for joining us here on the program. And Mr. Ni Akwete, a policy analyst and member Trans-Africa Forum's Scholars Council, joining us from Washington, D.C. I do thank you for your input on the program. I'm Beatrice Marshall in Nairobi. Goodbye.